kangaroo care, it's a mode of, you can consider it a mode of therapy for the premature babies and even for the full-term babies, which became famous when it started in the low-income areas where there is no incubators. So the people who started marketing this way, they use it because it does not cost anything. It is the lap of the mother or the breast of the mother. You are putting the baby on the bare skin, and it has certain consequences. Now, over the time, it has showed a lot of benefits, which is really important for any mother and any baby. For instance, number one, the breastfeeding. They noticed that the mother who's doing kangaroo care, that is putting her naked baby on her chest, on bare chest, and then cover him. This per se will stimulate the production of the milk of this mother of this premature baby who's in the NICU, and the amount of the milk will become more. And this is very, very important for the protection of the premature babies, because the mother of the milk, it contains a lot of natural antibiotics, we can say, and accordingly it was found that if you give the premature baby mother milk versus formula feed, the percentage of inflammation of the bowel and what's called necrotizing enterocolitis, one of the serious illnesses which happen in the premature babies, it's much less if he's on the breast milk. So it is a mean why I've chosen this topic, because I think there should be more stress by the physicians, more knowledge by the physician about the importance of breast milk, how to promote breast milk, how to increase the production of breast milk, and how to help the premature babies. Because also I can see in our hospital, for instance, our capacity is 64. Sometimes we go up to 80. That is over our capacity. Why? Because the number of premature deliveries in Dubai is becoming more and more, and actually worldwide. So one of the things which help the premature babies is the kangaroo care, and it doesn't cost anything except a chair and proper knowledge and proper setup. Staffing, because as I'm telling you, I mean, imagine this is a mother. I'm asking her to take the 1 kilo baby who's inside the incubator and put the baby on her chest. This baby is connected to tubes which is giving him oxygen. He's connected to IV. So in order to do this, you need 2 nurses at least to help her in setting up the beginning of the kangaroo care, because once the baby is taken and put on her chest and covered, finished. She doesn't need except observation from 1 nurse. So lack of staffing. Number 2, it needs proper training. So this is not a problem, because if you provide the training, everybody is willing to come. But from the side of the parents, the problem, many parents or many mothers nowadays, because they are working or they are, I don't know, they are not keen to give breast milk. So they will start giving excuse that they don't want to do this, they are afraid to hold the baby. But eventually, after proper explanation and teaching of these parents, we managed to convince really some mothers, even some fathers, as you have seen in the lecture, who did the kangaroo care, and they are staying for hours in the hospital giving kangaroo care for them. Proper training all the time for the staff, whether medical, doctors, nurses, the general, all the health sector actually. Like when we come to the conference, presenting such a lecture in a place where there is less number of neonatologists and more family physicians. making them understand the importance of kangaroo care and the importance of breast milk will help in delivering the message to the public about the importance of the breast milk, importance of participating in this in any way which can increase the breast milk, like kangaroo care. The first thing, as it is not a common practice in Dubai, I mean, we are one of the first hospitals which we implemented at full scale. So it's good to highlight about the topic as a whole. What's kangaroo care, how it is done, from where the idea came. So this was the main concept, because you don't need at this stage to give detailed information about kangaroo care. You want everybody to be aware about this concept.